As electric bikes continue to grow in popularity, so do concerns surrounding safety. Joining me this morning is Dr. Alreem Al Hinai, head of pediatric trauma surgery at University Hospital's Rainbow Babies and Children's Hospital. Thank you so much for being here. I have so many questions about e-bikes because they're everywhere now. And you're seeing a rise in injuries, but not just with e-bikes, but also with normal bikes. So what do you want parents to keep in mind?
Yeah, so, first of all, I want to educate parents that we are seeing quite a substantial increase in the number of injuries, but also the severity or the degree of injuries that children have with those, with e-bikes and scooters. We've actually seen up to a threefold increase in the number of injuries in the past 2 to 3 years that we saw at Rainbow. And, unfortunately, those injuries were disproportionately more intense or more severe and caused a lot of head injuries, but also internal organ injury in those children, much more than any other types of mechanisms of injury that we've seen. And so I want to educate parents, first of all, about the fact that they are pretty serious. The injuries that can happen because of them are serious. The other things I wanted to educate parents about is really to learn a bit more about what there are so many different types of e-bikes. There are different levels depending on how fast they go and what mechanism is used to propel the bike forward. I want parents to make sure that children wear helmets whenever they're operating e-bikes. And then if they're older children, and they're operating those vehicles on roads, they absolutely need to be educated about road safety. Just like anybody who's driving a car has to have a license and go through education for that, I would highly encourage parents to introduce their children to a lot of online educational resources that can make them safely operate those vehicles on roads.
So we were talking about normal bicycles and e-bikes. Are you still seeing major accidents with normal bikes, or are they connected with e-bikes somehow?
We see both. I want to say we've seen more e-bikes related injuries than regular bikes, but in all honesty, both do still exist and they happen. The difference with e-bikes is because of their speed, the injuries tend to be more severe compared to an equal level of type of injury from a regular bike, because they just don't go as fast.
Are you seeing injuries to pedestrians, like a kid with an e-bike might hit somebody walking a dog or something?
Yes, I want to say that has happened too in the past few years. So again, bringing back the point of safety of where are you allowed to use the bike? On the road, on the sidewalk? What are the regulations around that? But also educating children about acceleration and deceleration, how fast these can go and how farther out do you need to brake compared to a regular bike. Is very important.
Would you like to see more legislation or more city ordinances relating to these things and more enforcement?
Absolutely. I think that they're here to stay. They're in a way a good means of transportation, and they're environmentally friendly. But I think that we need to have more legislation around the usage of these devices by children specifically, enforcing education and making sure that children again know how to use these on the roads and road safety. But also where they can use them and adult supervision, especially for smaller children who use those devices.
You mentioned internal injuries. That's not really common with a regular bike injury. So what are you referring to? And that's pretty serious.
Yes, unfortunately, we see a lot of really bad head injuries. So that's injury to the brain or bleeds inside the brain, especially if the child was not wearing a helmet. And then in addition to that, injuries to the chest, so lungs, ribs, internal organs like the belly, for example, the liver or the spleen, all of those injuries can happen quite significantly from how fast these bikes go.
So these are life-altering injuries that parents need to be aware of with
Absolutely,
these.
yeah, absolutely.
Right. Dr. Hinai, thank you so much. I appreciate it.
Thank you for having me.
All right, back to you guys.